Hello everyone, I am Dr. Swati Pandey, a craniomaxillofacial, cosmetic and hair transplant surgeon, and today I will be speaking on hair anatomy and physiology. As a hair transplant surgeon, I would say that to treat any abnormalities of hair, a clinician should know the basic anatomy and physiology of human hair. The two basic parts of hair, a living and a non-living part. The living part, also called as the hair follicle, which extends into the dermis, whereas a non-living keratinized part, which is also called as the hair shaft, which extends over the skin surface. The growing structure of the hair at the opening of the sebaceous gland is called as the infundibulum, whereas the bulging part in the dermis where the piloerector muscle attaches, called as the isthmus. The part above the bulb is called as the suprabulb, and the part which contains the hair bulb is called as the bulbous part. In a transverse cross section as shown, the innermost part is called as the medulla, whereas the part above it is called as the cortex. Both of them form the structure or the pillars of the hair shaft. The cortex is further covered by protective layers called as the inner root sheath and the outer root sheath. The inner root sheath consists of the cuticle, Henle's layer and Huxley's layer, whereas the outer root sheath is covered by the glassy membrane and the fibrous sheath. In a longitudinal section, we can see that it is attached to a sebaceous gland which channels sebum along the hair follicle to the scalp surface. The dermal bulge in the hair, in which the erector pili muscle attaches, when on activation causes erection of the hair. The next structure is the hair bulb, which is the most vital and important structure of the hair and should be handled carefully during hair transplant surgeries as it contains regenerative cells. The hair bulb is attached to a vascular structure called as the papilla, which supplies constant source of nutrients and blood to the hair bulb. To understand the language of hair transplant, we have to talk in terms such as follicular units, micrografts, mini-grafts, and hair density. So a follicular unit is a collection of hair strands, either one hair, two hair or three hairs, which is held by a connective tissue. So if a follicular unit consists of a single hair, it is called as a micrograft, or more than one hair, it is called as a mini-graft. Hair density is calculated as the number of hairs per centimeter square, which on an Indian scalp may range from 260 plus minus 30 hair per centimeter square. This can also be equal to 1 lakh or 1,40,000 hairs on a human scalp, or if it contains a double unit follicle or double hair strand follicle, it can range from 50,000 to 60,000 hair follicular units in a scalp. Although all human hairs have same basic structures and are made of alpha keratin proteins, they can be further divided into three types, that is vellus hair, terminal hair and lanugo hair. Vellus hair is soft, hypopigmented, unmodulated, less than 0.03 mm in diameter and less than 1 cm in length, and is present mostly on forehead and extremities body parts. Whereas terminal hairs are longer, coarser and with variable pigments, with more than 0.06 mm in diameter and more than 1 cm in length. The terminal hairs are present on scalp, eyebrows, facial hairs or the mustaches, the axilla, groin area or the pubic area and the chest areas. It is estimated that over 5 million hair follicles are developed during the fetal stage of the human development, and no new follicles are developed on adult skin. Although the size and the caliber of the follicle may vary depending on the circulating hormones, that is the dihydrotestosterone. So the one more less commonly hair type is the lanugo hair, also called as the fetal hair, which ultimately sheds off in the fetus. Each hair follicle has a unique capacity to reconstitute itself through its unique growth cycle. The first phase of the hair cycle is the anagen phase or the active growth phase, which lasts for 2 to 6 years. And it is interesting to know that 80% of the human scalp hair is present in the anagen phase. The next phase is the catagen phase or the transition phase, which lasts for 2 to 3 weeks. The next phase is the telogen phase or the resting phase, which lasts for 2 to 3 months. And at any point of time, the human scalp hair has 20% of its hair lying either in the catagen or the telogen phases. The next phase is the exogen phase or the shedding phase, followed by the kenogen phase or the regrowth phase, which ultimately leads the cycle to its first stage, that is the anagen phase. It is interesting to know that different body parts have their different anagen phases. For example, the scalp hair have an anagen phase of 2 to 6 years, but the eyelashes may have an anagen phase of 1 to 6 months only. The growth rate in a human hair which is healthy is 1.2 centimeters per month or 0.35 millimeters per day, and every hair goes into at least 15 to 20 cycles in its lifetime. Therefore, it can be said that hair fall is a natural phenomenon and at least 60 to 80 hairs can fall in a day, which is normal and should not be confused with hair loss, which is a pathology. Therefore, I would like to conclude that the hair growth, their sustenance and their life depends on various factors, which consist of a hormonal regulation of dihydrotestosterone, consistent blood supply and nutrients to the hair bulb and the scalp, and maintaining a general systemic health. Thank you.